This is Bob Finn with Global Medical News Network. I'm at a meeting on cosmetic dermatology with Dr. Joe Cohen, who appears to have found an entirely new part of the body to treat with fillers. Dr. Cohen, can you tell me about that?
So over the course of many years, I've noticed that many patients become concerned about their décolleté area. There's been reports of using various treatments. I've tried botulinum toxin, and despite some reports of efficacy, I haven't been able to actually see this type of efficacy myself. People have topically treated it with retinoids, and although that can be helpful, there are patients who have more severe crumpling of the skin. So I have recently started in a few patients using fillers, and by putting in products such as hyaluronic acid products like Juvederm or Restylane, and really molding that product into the area, we're able to occupy some volume, and then going over that area with a fractionated laser type of device over a course of a couple treatments, I'm able to soften some of those textural changes and some of those volume losses in what my patient and I have called the peach pit.
You've mentioned that you've treated it in several different ways with several different fillers. Is there one that seems better than another?
No, I'd rather use a hyaluronic acid filler in this area, such as Juvederm or Restylane, because if you do get lumps or bumps or patients aren't happy with it, you could really inject an enzyme, hyaluronidase, and make it go away. It's easier to mold out little contour regularities with these types of agents as well.
How long does the effect last?
You know, it's interesting. You can repeat the treatment, as much as you really need to in terms of space occupying and stimulating collagen, but similar to fillers in the face, you can use a product and you may have to use 2 or 3 syringes of product, so up to 3 cc's or so initially, and that after 6 months or 8 months you may just need to sort of top it off with 1 or sometimes 2 syringes, and it seems to last longer over longer periods of time and more treatments, and it seems to require less product over longer periods of time as well.
How happy are your patients with the result?
There's only a few patients that I've treated in this area, but they've been pretty happy.
Now, the peach pit joins a long and distinguished line of cosmetic effects named after food, doesn't it?
Dermatologists, I think, have long been fixated on foods, and in medicine in general uses so many different food analogies, but at least in the aesthetic space, we talk about people who have peau d'orange changes on their upper lip. We talk about people who have apple dumpling chin. Peau d'orange changes we typically treat with laser resurfacing, and the apple dumpling chin we use botulinum toxin into the mentalis. There's also been reports of people using botulinum toxin to recontour people who have large and really muscular calves, and it's called radish calves.
This is Bob Finn reporting for Global Medical News Network.